Oops, I accidentally turned off the previous video clip too soon, so this is part 2 of protein and health. So the symptoms of kwashiorkor we talked about. Now this picture shows a little boy with kwashiorkor. You can see that the belly is bloated. You can even see some edema in the hands and the legs. And also the face, but notice how light his skin and his hair is, and that's because of the protein deficiency. This is a picture of a kid with protein deficiency who has a skin infection because of a depressed immune system. So the treatment of kwashiorkor is nutrition therapy, but you have to be really careful. The instinct when somebody has malnutrition is to feed them a lot, but you could actually kill somebody. It's called the refeeding syndrome. So the first thing you have to do is correct the fluid and electrolyte imbalance, because an electrolyte imbalance can kill you if your potassium is off, in particular, if it's not normal. You start with some type of protein-rich fluid. It could be skim milk, but if the person is protein malnourished, their digestive tract has likely degraded a bit. The villi might have atrophied or broken down, and it'll be hard to digest lactose because the lactase enzyme kind of lives on the villi. So a lactose-free, high-protein liquid would be good, but you want to refeed gradually. Give that digestive tract some time to heal, because if you feed somebody with a degraded digestive tract, they'll end up with diarrhea, and that could make the fluid and electrolyte imbalance worse. So they'll need vitamin and mineral supplements to achieve that catch-up growth, because first they're deficient and need to replete that, and then they'll need some extra nutrients for that catch-up growth. After about a week, you gradually add different foods as tolerated, and you focus on the high-quality proteins to facilitate the recovery, and you want enough fat and carbohydrates so that the dietary protein can be used for lean tissue recovery and not energy. Now, marasmus is a state of protein deficiency that's characterized by total starvation. You can see this little boy with marasmus is emaciated, doesn't have that fluid buildup. So this is total starvation, lack of calories and protein, and we do see this a lot. I see it most often in the elderly in the hospital, and people with anorexia nervosa. But people who are starving would have marasmus. The symptoms are really similar to kwashiorkor, except that they have an emaciated appearance. When you're protein malnourished, especially when you're starving as well, there is impaired brain development. The brains tend to be smaller in somebody who is protein or has marasmus, and we've seen this in brain scans of people with long-term anorexia nervosa. The growth will be depressed. Fluid accumulation only occurs in the very late stages, because they're less likely to get the liver damage, because they don't have that carbohydrate intake to convert to fat in the liver. The other thing that happens in marasmus, which is why it develops more slowly than kwashiorkor, is that when you're completely starving, the body adapts by lowering the metabolic rate and slowing down the rate of protein turnover. This does not occur in kwashiorkor. So kwashiorkor develops really quickly, whereas there's an adaptation to starvation that occurs in marasmus. The albumin isn't as low as it is in kwashiorkor because the protein turnover rate slows down. Albumin is a blood protein. Okay, so these are some pictures of some kids with marasmus. You can see that they're emaciated. There is some fluid buildup in the very late stages, but you can see that the hair is is a light color and kind of sparse. In this one kid, the hair is just kind of a dull brown instead of a nice shiny brown. You can see the loss of fat tissue in the face of this child. This is an interesting slide. It shows a 5-year-old who is closer to the size of a 2-year-old than a 4-year-old. The 5-year-old had experienced protein malnutrition and hadn't achieved catch-up growth. So the treatment of marasmus, again, is careful refeeding. And again, you always correct the fluid and electrolyte imbalance first because that is critical. And again, you want to avoid the refeeding syndrome. I see this in patients with anorexia nervosa. When they start getting tube feedings, they have to really monitor them carefully for the refeeding syndrome. Okay. First, if their digestive tract has been compromised, they may not be able to digest or absorb, and they'll end up with diarrhea. But also, when you've been starving, your insulin levels are really low, and then if you feed too much too quickly, the insulin levels increase rapidly, which causes electrolytes to leave the bloodstream, go into the cell, and you could develop low potassium, which could be deadly. Okay, so here is the good news: a child with marasmus before and after nutrition therapy. Although she looks happy before, but she feels a lot better after. Now we're going to talk about protein excess. So what happens if you consume excess protein? Well, you can't store amino acids, so you have to remove the nitrogen-containing group from them. So deamination is the removal of the nitrogen-containing group from an amino acid. The liver takes this amino group and turns it into urea, which is the protein waste product. If the liver couldn't convert the amino group to urea, it would become ammonia, which is toxic to cells. So here we have the nitrogen-containing group being lost. That's deamination, not to be mixed up with denaturation. And what's left of the amino acid can be used for energy or turned into body fat. Okay, so know the difference between deamination and denaturation. So what are the problems with high levels of protein in the diet, potential problems? Well, first of all, sometimes high protein diets are low in plant-based foods, which would mean that they are low in fiber and maybe missing or low in some vitamins and phytochemicals. Now, not all high protein diets are low in plant products, though. A lot of animal products are associated, will have a lot of saturated fat, so it could lead to a high saturated fat intake. And like we talked about, in some genetically susceptible individuals, and especially if your carbohydrate intake is also high, that could be a problem. It could increase your risk for cardiovascular disease and elevated blood sugar if a diet is high in both saturated fat and refined carbohydrates. An excessive intake of red meat has been linked with colon cancer. In your folder, I do have an article about the reason that red meat may be linked with cancers, especially the processed red meats. But there's a compound, TMAOs, that are produced by your gut microorganisms when you eat red meat that could cause some problems. Some people say that a high protein diet is hard on the kidneys. Actually, that's a little bit of a misnomer. If you already have kidney disease, a high protein intake will make the kidney disease progress faster to kidney failure. But a healthy kidney should be able to handle excess protein just fine. When protein excess becomes a problem is when it exceeds the liver's capacity to convert the ammonia from the amino group to urea, because ammonia is toxic. It's about the level of, they say really an upper amount of protein that's safe would be about 225 grams, depending on your size. Some people say that a high protein intake can cause calcium loss from the bones. The research that showed this, they use purified proteins, not whole food proteins. So they don't think there's as much of a problem with calcium from the bones when your protein comes from intact food sources. Okay. There is an issue that can occur if people consume a lot of individual amino acid supplements. They can cause, especially methionine and tyrosine supplements, because the body's designed to handle whole proteins, whole food proteins, not single amino acids from supplements. But the supplements can overwhelm the absorptive capacity, so you don't absorb all of it anyway. It's just a waste of money. And then excess of one amino acid can diminish the absorption of other ones. Now, this is really important. Recent research, and actually it's been going on for a while now, but older people who take a protein supplement between meals have a slower loss of lean mass. When you get older, you start losing body protein. It's called the sarcopenia of aging, where you lose muscle mass, especially over age 60 and dramatically over age 70. My dad experienced this. He was a big muscular man, and in his 70s, he got really weak, especially when he was really stressed out when my mom got sick. He lost a ton of weight, and that weight loss plus the sarcopenia of aging, he could barely pick up his feet and walk. He just shuffled. And so one of the things that, for his rehab was that we had him eat protein regularly throughout the day. A lot of people have lower protein intakes in the morning, but we had him eat a good amount of protein at breakfast, lunch, dinner, and between meals. Okay, so think about, your meals, and if you have an imbalance throughout the day, a higher intake at one meal than other meals. So a guideline to maximize, muscle protein is about 30 to 35 grams at breakfast, lunch, and dinner for people at risk for muscle loss, and then some between meals for a snack. Okay. So these are just some things to think about that we'll cover a little bit later. The next video is going to talk about recommended protein intake.